Wondering what's the buzz? Then tune into Happy Hours for your dose of all that matters. The exclusive HR podcast by NHRDN in partnership with Timber Media, podcaster for India Inc.
Hello everyone, a very warm welcome to yet another episode of Happy Hours. I'm Lionel Paul David, Vice President of NHRDN Chennai chapter, and I'm your host for today. We have with us two eminent trailblazers who are also thought leaders in the space of mental wellness. This husband and wife team developed a comprehensive system for training members of the public and healthcare professionals on how to recognize and to care for those with mental health issues. As a young woman, Betty Kitchener trained as a teacher and worked in special education before developing a career in psychology, counseling, and nursing, and she was an adjunct professor at Deakin University. Professor Tony Jorm is an Emeritus Professor at the University of Melbourne and NHRDN Leadership Fellow. His research focuses on building the community's capacity for prevention and early intervention with mental disorders. Professor Jorm is the author of 34 books or monographs, over 600 journal articles, and over 30 chapters in edited volume. He's been listed in ISI highlycited.com as one of the most cited researchers in psychology and psychiatry. Betty and Dr. Tony were co-founders of Mental Health First Aid, MHFA Australia, a national non-profit health promotion charity focusing on training and research. Over the last 2 decades, it's spread over 25 countries and over 3 million people worldwide have undertaken the training, including people like Michelle Obama, Patrick Kennedy, to name a few. Betty served as the CEO of MHFA Australia and Dr. Tony Jorm serves as the director and chair of the board MHFA Australia. They have authored many first aid manuals and literature on mental health together. So it comes as no surprise that the program and its co-creators have won several awards and accolades. I thank you both for taking time to join us and welcome to Happy Hours. And how are you doing today?
Very happy to be here. Thank you.
Very happy.
Thank you. Our show has 2 segments. Our first is Bottoms Up, where apart from your expert inputs, you can share anecdotes from your experience to help our audience to relate easily to our discussion.
Bottoms Up.
Bottoms up!
To set context, along with this pandemic came home isolation, quarantine, lockdown, and other containment efforts, job losses, fear of contracting the virus, pay cuts on one side, increase in workload, juggling with multiple work-home responsibilities, especially attending to children and older people on one side. So it comes as no surprise that there's a 20% spike in the number of mental health cases reported according to the Indian Psychiatry Society. The situation is no different elsewhere in Asia, as the trend is similar in Indonesia, Thailand, Philippines, to name a few countries. So, is there a looming mental health crisis? If yes, how big can this issue become? And what are some of the high impact and quick measures that need to be put in place in order to address this?
Well, we don't actually have a precedent to know for sure, because the last big global pandemic was, of course, a century ago with the Spanish flu. It seems likely there would be, and most mental health experts believe there will be a wave of mental ill health that will follow the wave of infection. And the reason for expecting that is that a number of known risk factors for mental health problems are increasing as a result of the pandemic, as you said in your lead-in. We know that when there's a threat to somebody's safety, as there is with the risk of infection and possible death, we know that increases anxiety. We know when people become physically ill, they're more prone to depression long term. We know that unemployment is increasing, financial problems, they are risk factors for depression. Social isolation is a risk factor for mental health problems. So there are the direct effects of the infectious disease itself, which will affect mental health, and then the indirect effects from the broader social and economic effects of the pandemic. So for those reasons, most mental health experts are predicting there will be a wave of mental ill health and possibly of suicide. Now, on the issue of suicide, we know that things like becoming unemployed and having financial crises are risk factors for suicide, but we also know that during periods like wartime, where a society is working towards a common cause in the war, we know that suicides can paradoxically go down. So if everybody in a nation is pulling together in a common cause, in Britain Blitz spirit, where they're all bombed by Germany in World War II, and there was a feeling of everybody working together in this struggle. We know that can have a mitigating effect, and then risk can decrease. So we don't know how much there's going to be a blitz spirit, as it were. But that would be something that would be good if nations could cultivate that. If we could feel we have a common enemy here, the virus, and we're all working together, not only as local communities and nations, but also as humanity as a whole globally. There are protective things that could happen there. So how do we deal with this potential wave of mental ill health? Well, it parallels the way that we're dealing with the infection. There are two ways of dealing with the infection. One is a prevention, and the other is to increase the capacity of the health system. So prevention for the infection, we all know the sort of things. We have social distancing, we have people wearing masks, and we have social isolation of people who are infected and so on. So they're the preventive measures. And then we have the health system measures where we try and increase the capacity of the health system. So we allow for the capacity to do more testing, we get more ICU beds, more ventilators and so on. And you need both approaches, prevention and increasing the capacity of the health system. And similarly with the wave of mental ill health that is anticipated to follow, we need both these approaches. We need a preventive approach and an increasing capacity of the health system approach. So prevention, we need to look at what the risk factors are. So unemployment is a major one, reduction in income is a major one. And in Australia, I must say the government has done an excellent job on this. They've introduced emergency payment to keep people in jobs, to support people in jobs, to subsidise businesses to keep them going. And for people to lose their jobs, they're giving them additional support, which takes away that stress of financial difficulties, but also helps stimulate the economy. So they're very good things to do. It's going to be very difficult to keep those going in the long term because there is a substantial cost, but they are very protective of mental health as well. And then there are things people can do themselves, like preventive self-care activities. There are all sorts of things that we can do if we're getting mild symptoms. So if people get mild symptoms of anxiety and depression, usually people do things in their lives that actually reduce those and stop them getting to the level where it's being very disruptive in their life and it's getting to the stage of being a mental disorder or a mental illness. So there are all sorts of things you can do to dampen down anxiety, which many people would do, like physical activity is known to dampen down anxiety. There are things like meditation, like mindfulness meditation, other types of meditation. Yoga, of course, we got from India. Things like progressive muscle relaxation. They're all methods that can reduce anxiety and they can stop it getting over the top. Another thing is to seek social support. It's a very important protective factor. So if you can talk about your problems with a trusted person, unfortunately now we have the technology, even though we're not able to have physical contact, often we can have online and phone contact to get social support, but that is really important. We know that adopting healthy lifestyle is important. I mentioned physical activity, things like having regular sleep patterns, like going to bed and getting up at a regular time, having regular leisure time activities, getting pleasurable activities. But also we need to, I think, sometimes cultivate acceptance too, because situations like this, sometimes there are things we can't do about it. We need to really see that our anxiety in these situations does have its positive, because anxiety is a very useful emotion. I mean, it protects us from danger. Like, we didn't have the fear of the virus, we wouldn't be taking protective measures. So that anxiety is a good thing, and anxiety prepares us for action in emergency situations. And it's only when that anxiety gets to a very high level and disrupts our life in a major way that it's a problem. So we should accept that we're uncertain, there are questions without answers at present, and we're going to experience anxiety, but see, that anxiety is really our friend as long as it doesn't get out of control. So they're the preventive aspects of what we could do. And then there's the health system aspect, like how do we increase the capacity of the health system to deal with mental health problems when they get out of control? Well, what's happened in Australia is the government supported switching over to telehealth. So face-to-face services have now, to a large degree, gone over to telehealth, where we can have social distancing. And certainly in Australia, we have very good online mental health treatments, cognitive behaviour therapy-based treatments, which have very good evidence base, and they're available freely to Australian citizens. And I hope people in other countries who are listening will have some of those available to them too. If they don't, I know organisations can purchase availability of those online treatment systems. So there are ways that we can increase the capacity of the system, even though we've got these restrictions of having face-to-face contact.
Okay.
The exclusive HR podcast by NHRDN in partnership with Timber Media, podcaster for India Inc.
So as a follow-up to my earlier question, because you've given us a very good amount of comprehensive measures that needs to be put in place to address this issue, can you tell us what companies can do to support their employees who are experiencing distress, to cope with the stress and fatigue of remaining responsive online all the time, contain and prevent risk of clinical depression, anxiety, and even suicide, which you mentioned?
Well, ideally, a large company should have a mental health and wellbeing strategy already. That's the ideal. That's what experts in workplace mental health say should be done, and that should have the support of senior management. And that would cover a whole lot of areas that could be adjusted for the current pandemic. But quite apart from that, let's assume that doesn't exist. I think what I would suggest to somebody who's in a management role, whether it's of a small team or a larger organisation, is that they need to assess what additional stresses are going on with employees. So if you had a small team, you could meet with people one-to-one, or you could have a small group meeting and say, well, all right, what's causing people stress now? What are the barriers to getting your work done? And problem solve how we deal with them. If it was a larger organisation, I'd do a survey. I'd get a Survey Monkey or other application, put out a survey and find out what are the stresses, what are the barriers to getting work done. And then I'd work with the employees to come up with strategies to deal with it. And they won't be able to deal with everything. All right, so some things, there could be, a loss of business activity, a threat of unemployment. The business could be in financial difficulties, but to have people involved, not to keep them in the dark. And uncertainty creates anxiety. So if you can keep people informed and keep them involved, and being part of the response, everybody working together, a bit of this sort of blitz spirit, you can help protect them from the ill effects. The other thing I would do is I would emphasise that workplaces, their major function is to produce the work, but also they're important sources of social support. And I think we need to be mindful that when people are now working off-site, we need to be able to keep that social support going. For example, I work in a small team of researchers at the University of Melbourne, and we always have Monday lunch together by Zoom, and we sit and eat our lunch and we talk to each other about work and other things, and we celebrate each other's successes, and we talk about any difficulties people have in their lives. So we try and keep that social support going. I know in the one of the senior managers in the area where I work, regularly I get a message on email saying, I'm available for lunch now via Zoom, and she regularly is available to anyone at a set time every day to eat lunch and talk with them. I think that's very good. Also, the School of Population Health where I work, which is a very large school, used to always have on Thursday mornings a morning tea where people would take turns bringing in some food and serving the tea and coffee. We'd all take turns doing it, and you'd meet people from across the school that you mightn't otherwise meet. But that's done online now as far as possible. So we need to try and continue that social support function as much as possible. And the third thing I think we do is try and promote self-help strategies. I mentioned a lot of those before, but what people naturally do when they're stressed. But sometimes people use self-help strategies that are not useful ones. Particularly, people use things like alcohol is a big one in Australia that people use. And, things like alcohol can reduce anxiety in the short term, but they make matters worse. They make anxiety and depression worse in the long run, and substances in general, have a lot of costs when people often use them to deal with stress. But there are all these positive things that people can do. Like I mentioned, there are ways of damping down negative emotion that I mentioned, like physical activity and yoga and meditation and progressive relaxation. They're, seeking social support. There are good lifestyle things that people can do. And there's cultivating acceptance of what we can't change, And they're all things that could be promoted in a workplace as much as possible. I think that pretty well covers it.
Okay, thanks, Dr. Tony, because I think there's enough takeaways for the HR and business leaders listening to this podcast to look at a list of action plan that they can implement in their workplace.
The exclusive HR podcast by NHRDN in partnership with Timber Media, podcaster for India Inc.
My next question to Betty would be, in 97, when Professor Tony coined the term mental health literacy, and 3 years later, both of you developed the mental health first aid training to improve the level of mental health literacy. It would be interesting to hear from you about the roots of mental health first aid, to hear about the circumstances, the needs, and your work that got you both thinking in these lines.
I'd love to tell you. It all began when Tony and I were walking our dog. Well, that's really when we started talking about we need to develop a mental health first aid course. Now, that was a couple of years before the turn of the century. But going back to when Professor Tony Jorm and his colleagues at the Australian National University coined the term mental health literacy, they did the very first big national survey across Australia. They did it in 1995, published 1997. Of what was people's knowledge about mental health, what was the public's attitude towards people with mental health problems, what did they know about what would help, what wouldn't help, etc. And this is what was termed mental health literacy. So there's evidence now from a number of mental health literacy surveys done in several countries that there's really quite a lot of deficiencies in the public's knowledge about how to prevent mental illnesses. Members of the public often don't know how to recognise when a mental health problem is developing. They don't have the knowledge about help-seeking options, where to go, who's good, who's bad, what treatments are available. They don't have the knowledge about the evidence-based self-help strategies that are available for the milder mental health problems. And we realise they don't have the first aid skills to support others affected by mental health problems. And this is at a time when there were already quite a number of first aid courses, programs running across a number of countries, not just English-speaking countries. Many countries have had first aid courses for a long time. And it's interesting, isn't it, to think, why didn't someone else think about this while they were walking their dog, that what we also need are courses to teach members of the public mental health first aid skills. So Tony and I lived in Canberra. We moved down here to Melbourne in 2005, but at this time, before the turn of the century, when we were walking King, our dog, we lived in Canberra, and we just decided we had to write a course to improve the public's mental health literacy, to empower the whole community to take action for better mental health. And at that time, I was a registered nurse working in the Canberra Hospital in various areas, and I also, in my spare time, was an instructor for regular first aid. I'd been a teacher in an earlier time in my life, and I loved teaching and I loved the health area. So I was aware of what they taught in first aid courses with Red Cross, and very much realised there was nothing there about how to help someone with mental health problems. And as we all know, they're as common, if not more common, than many of the physical illnesses that we learn about in first aid courses. So we got going writing a curriculum, writing a course. And Tony and I just thought this will be a free course that we run as a community service for people living in our city, Canberra. And, we might run a couple of free courses each year. I reduced my full-time work in the hospital and then got going with getting the course running, and Tony's academic input made sure that the course was as evidence-based as possible. Now, at this stage, there wasn't much research around what is the first aid that members of the public can do. There was evidence of perhaps what clinicians should do, but not so much what members of the public can do. But we got a reference group together and we did the best we could with that, getting a curriculum together. As we'll probably hear a bit later, we then did a lot of subsequent research and developed mental health first aid guidelines to inform a better course. So I conducted the very, very first mental health first aid course for the public at the end of 2000 in Canberra. And Tony and I developed, right from the very first course I delivered, Tony and I had pre, post and 6-month follow-up evaluation questionnaires that we handed out to every attendee. And we were able to publish our first evaluation of the mental health first aid course in 2002. And it was a well-designed study, and the outcomes were very positive. People who attended the course had much better recognition of how to see that someone may be developing a mental health problem. They had much more improved beliefs about what treatments and the treatments that have got evidence that work to help with mental health problems. They really improved their attitudes toward thinking about people with mental health problems, and they had increased confidence in wanting to be able to give help. And we also asked them how much help they were able to give, and there was an increase in the help that they provided people that they met with mental health problems. So they were amazing outcomes for the course.
Wonderful to hear that story of how this whole thing started 2 decades back. So in continuation to my question on the roots of mental health first aid, can you share how this spread as a global movement that is today present and recognized in over 25 countries? How did you scale this? How did this evolve over the last 2 decades? Most importantly, from a global perspective, what are some of the most common issues around mental health, and what are some of the unique issues that are specific to a region or a demography, if there are any?
That's a big question, yes. Tony and I never envisaged this is going to be a global course. As I said, we thought it would just be our little community contribution, in Canberra. And so we were amazed, that it spread across Australia, let alone then went global. And, I think it really took off. It was just the right course at the right time. I think the world was ready for it. Attitudes were changing. There were regular physical first aid courses were being conducted in many countries. And I think more attention was beginning to be paid by governments to funding mental health services and mental health research. And I think there was a growing realisation in many places that there needs to be parity, providing mental health first aid courses and physical first aid courses. The public needs this knowledge. Because we got into collecting evaluation data, which turned out to be very good outcomes, and we had good scientific design, we published these outcomes in scientific journals. Influential people around the world were reading these, and some influential people, say in Scotland, Hong Kong, England, Finland, Canada, they were some of the first countries that took on our program. They were people who were perhaps working with the government or in large organisations that had some funding, and they thought rather than recreating the wheel, they'd rather take the course we had, which had such good evaluations, and that's how it began to spread. I remember the very first email I got, I think it was 2002, from Mr. Gregor Henderson from Scotland saying, we'd like to fly you over and we'd like you to train us in the mental health first aid course. And I was flabbergasted because we were still at this stage thinking, this is just a little course for our community. So, and then it was soon after that I got an email from a very large mental health organisation in Hong Kong, and then Canada, England, Finland, etc. And then it just exploded. I've had the great privilege of taking the course, of being taken across to many different countries and delivering the course there. So our organisation, Mental Health First Aid Australia, it's also trading as Mental Health First Aid International, we have a licensing agreement with these different organisations. They have to stay true to the course, but of course they can culturally modify it, and this is just so important. And this is how the course differs across the different countries, in that the terminology has to be right, the pathways to care has to be right, some of the cultural aspects that need to be respected, whether it's a male helping a male or a female, and different things like that, and maybe within family what can be said and what can be said outside the family. But when it comes to what are the signs and symptoms, what are the risk factors, what's the first aid that can be given, it really is pretty universal. It really does fit globally across the world. What we also realised, the course need to be modified not just culturally but for different age groups and for different professional groups. So the course now is designed for teenagers, helping teenagers, adults working with teenagers, so teachers, sports coaches, except youth workers. We have the adult course, adults helping adults, and then we have a course for older people, because so what often happens with older people, if they have depression, anxiety, or lose contact with reality, everyone just thinks, that's just par for the course for aging. They're getting dementia, or they're getting forgetful, or they're down in the dumps because, they're getting old. And that's not the course. Not old people don't need to have depression, anxiety. And so often it gets overlooked. So that was a course that we also needed. We've also modified the course for pharmacists. They have a bit of a different role. We've modified the course for the legal profession. We've modified the course for teachers and a number of different professions. I think I'll leave that response at that. Thank you, Lionel.
Okay. So thanks for answering all the questions in section 1. And now we move to the second and interesting part as we brace up for the rapid fire. So I have 2 questions for each of you, and I hope you're ready.
The rapid fire round.
So my first question is mental health everyone's business?
I'm answering that one. The answer is yes. And the reason is that we have a whole lot of surveys in countries throughout the world, community surveys, looking at how many people have mental illness in a year. And what we find, like in Australia, it's about 1 in 5 adults a year, and it's similar in other countries. So I don't know what it is in India, but it's probably not dissimilar. But so you imagine if it's 1 in 5 with a diagnosable level mental health problem in a year, think of the number of people in your family, the number in your workplace, your neighbourhood, your social network. If it's 1 in 5, it's either going to be you or it's going to be multiple people that you have close contact with. Whether you know it or not, you will have close contact in any given year with people. And what you can do can make a difference. So we can all take action on prevention. They're simple things we can all do to prevent in ourselves or our family. We can get better at recognising where there's a problem. We can know about seeking appropriate help if we're affected ourselves, and we can know through mental health first aid, we can know how to support people in our family, workplace or social network are affected. So the only way we're going to really have a major impact on mental health problems in the community is if everybody's involved.
Right. So your word of advice to anyone suffering from any mental health issues?
Mental health problems are very, very common. And mental health problems, they're an illness like any other illness. And there are a lot of things that are known that can help. There are professionals, there are other people in the community, friends and family, and there's self-help. Please reach out for help. Don't be embarrassed. Remember, these problems are very common. People do know about them. Don't hesitate to reach out for help. Try and find someone who's caring, someone who can give you social support. And you try and see how you can give back too, because the very nature of giving so often helps to help you to get better also. How can you give care? Find out about self-help activities that you can take. You can get into physical activities. You can set little small goals each day. Sometimes you get so sick it's hard to even get out of bed, but just that goal that I will be out of bed before such and such a time, I will get out of my pajamas. Set just little goals. And then get out of the house each day. That's really important. It's the hardest thing usually is to get out. But once you get out, you think, wow, this is okay. And check out the best professional help that you can source, if that's possible for your area. And if not, find if there's some online sources of help that you can find.
Thanks, Betty. My next question is one thing each individual can do to take care of their mental well-being.
Well, I'll handle that one, and my answer just complements Betty's previous one, that an important protective factor we know from research, a lot of research shows this, is good social support. We all need someone who we can talk to openly when we have problems, who listens and who accepts us. And if you already have such a person, then you're blessed. And if you don't, it's important to prioritise finding such a person and creating a mutually supportive relationship with them. And one of the key aims of mental health first aid training is actually to improve people's capacity to be good social supporters, to learn how to listen, not to judge the person, to provide them with practical help. And we know that if people do provide that support, it can lessen the effects of when people are having major stresses or traumatic events, and we also know that good social support speeds people's recovery if they're having mental health problems. So I'd say that's the key thing. good social support.
Okay. So what are some tangible ways in which an organization can include mental health into its overall work environment?
Well, I'll handle that one too, because I alluded to it before, but I think large organisations need to create a mental health and wellbeing strategy with the support of senior management. And there are guidelines from experts on how to do that. But one element that I will mention, because it's relevant to our talk today, is that the experts in these guidelines say that workplaces should make available mental health training. And there are many sorts of training. Mental health first aid isn't the only one, but it is an important form of training that is suitable for this. We have done a number of randomised controlled trials in workplaces where workers are trained with mental health first aid, and we have very good evidence that it has benefits, that people get to know more about mental health. It reduces stigmatising negative attitudes. It increases the support that employees provide to each other with their mental health problems, and also support that they give to family members, which can impact on their functioning at work. So I would say there's a lot you can do in the workplace, but mental first aid training is one very useful approach that workplaces can make available.
Thank you both for your answers. I'm sure all our listeners enjoyed it like I did. On behalf of NHRDN, I once again thank you both for taking time to join this chat.
Thank
really
you.
Enjoyed it. Thank you.
Yes, thoroughly enjoyed it. Could keep talking.
It was my pleasure chatting with both of you, and I wish you well. Special thanks to Erinda and MHFA India team for connecting us and helping us to discuss this important topic of mental health and well-being. To our ever-increasing audience, thanks for listening to this episode of Happy Hours. If you liked our show, do share it with your friends and share your feedback with us. This is Lionel Paul signing off, and see you soon in another episode. Bye-bye.
Wondering what's the buzz? Then tune into Happy Hours for your dose of all that matters. The exclusive HR podcast by NHRDN in partnership with Timber Media. Podcaster for India Inc.